Okay, so for a hospital setting, I'm going to go in there, ask the patient's name and date of birth, and also confirm it with their bracelets. They're going to have a bracelet on their arm here to indicate, you know, if they're at fall risk. Obviously, their name and date of birth, that'll be a separate bracelet. And sometimes these people will also have limb alert, will indicate, you know, that they've had a mastectomy, a fistula, etc. So always be on the lookout for that, and look out for any IVs placed anywhere on the arm. And you never want to draw above the IV or under the IV. Unless it's shut off for 10 minutes, then you can. So, all right. So I asked the patient's name and date of birth in the hospital. Say they're laying down. I asked them if it's okay to sit them up just so gravity can do its thing. It has made it so much easier to set the patient up. There were times when I was in the hospital drawing patients laying down, and it took me a hot minute to realize that sitting them up would help. So I learned that tip and trick. And also, so say they only have one available arm, I'm just going to look around and see if there's anything good. So I'm going to place this tourniquet on their arm, and they have some decent looking veins, so I'm going to use a 23 gauge needle. Now if they have really tiny veins, I'm going to use a 25 gauge needle, which is this. But for now, I'm going to use a 23 gauge needle because that just is the best thing to do for a vein that size. So I'm just going to place the tourniquet up around their arm like this. Make it decently tight, not so tight that it constricts their arm or their blood flow. You know what I mean? Okay. And so I'm going to start palpating right here in the AC. Oh, that's nice. That's a really good vein. This patient is decently healthy. He's not super dehydrated. A lot of the times in the hospital, a lot of the patients will be dehydrated. So sometimes you have to, you know, hook them up with some water, maybe even go get a little heating pad just to get those veins to pop. Those are also some good tips, you know, if you are having a really hard time finding their veins. But here, I found a good vein right there. So since I found a good vein, I'm going to untie that tourniquet, boop, and I'm going to sanitize that area. And I was called to do a rainbow on this patient, for instance. So when I have to do a rainbow, say that their other arm's got a heparin drip. So we're going to check the coagulation in their blood. So what I'm going to do is I'm going to let that air dry, put that tourniquet back on. So I know the colors are different in each state, but for us it's blue tops for PTT. I get my needle ready, which doesn't take too long to get it ready, but probably put that tourniquet on a little too early. Should have gotten my needle prepared. Okay, so when you're drawing a PTT, you want to have a discard tube to go with it. Otherwise, you're not going to be able to fill that black line up properly. So this is my discard tube right here, which I only need to fill up to just right about the bottom of that line right there. So cool. All right, let's get started. We're going to check the coagulation of the blood. So, all right. You don't want to go in super slow, but if you can, go in a decent place. And, all right, we're getting that blood flow at the end there. Get rid of that tube. Okay, we're filling that little tube up. We're going to fill it up to that black line. Because when you go slow in a patient's vein, it's going to hurt. I've learned the hard way. So don't go super slow. You obviously don't have to go as fast as I did. That's just force a habit. And the faster you go in a patient's vein, the less they're going to feel it, and the less the vein will move. But the slower you go in a patient's vein, they're going to feel that pain, and they may even tense up, which also tensing up can make that vein disappear, and then you have to do the whole process over again, which kind of stinks. And I've done plenty of that in the hospital. So we got a successful blood draw. So we're going to our red top because we're checking other things like testosterone, for instance. Okay, fill it up at a pretty good decent height there. Gonna fill a gold top because we're gonna check their C-peptide. Okay, it's filling up really good. All right, it's all the way to the top. Now we're gonna go to a green top, which checks their kidney function, troponin, bunch of different things. Chemistry test. We're going to invert it 6 to 8 times, Make sure we're mixing it. Gives it a better result for the specimen processors when it gets down to the lab. All right, now we're down to our complete blood count. This is what you draw it in. So we want to fill that up good too. Invert it. All right. All right, so say it's already halfway up there. We want to release that tourniquet so it doesn't blow the vein. All right, still filling up a little bit more. All right, we're gonna release that. Then obviously never take the needle out with a tube in the hub, because that will definitely blow the patient's vein and actually may hurt them too a little bit. So all right, we're done with the blood draw. Hold that site pretty good with a decent amount of pressure, especially if they're on heparin. They're gonna bleed really good, so apply some good pressure to it. Okay, and then we're just put that Coban around them because it's nice on the skin. I don't ever like to use band-aids on patients in the hospital, especially because a lot of the patients I draw have just very, sensitive skin, and I don't want to rip their skin off. They don't need more pain than they already are going through. And so bada bing, bada boo. And then anytime you are drawing the patient's blood and you're finished, label your specimens next to the patient. Because in case you miss something, you're right there and you don't have to go back, because they will reject the specimens if they're not labeled properly. So I'm going to put the time and date and my EMP, Cerner, whatever you want to call it, on the tube and the time of collection. And all right, then I send it off to the lab and we're good.